Well, kind of. More than half of men in their 50s go through what's called andropause. It's a sort of male menopause. Dr. Larry Emdur is here from Alvarado Hospital to talk about it and what you can do to treat it. Okay, so this concept sounds a little wild, but I think this is good for everybody to listen to, not only men, but also women, because they got to deal with the men in their life as well. What is andropause?
Andropause is a condition where testosterone, which is the major male hormone that defines our maleness, decreases. After about age 30, all our hormones are decreasing. And what they found is probably about 50% of men age 60 are going through andropause or male menopause. And the diagnosis is really symptom-based. It's a matter of the male kind of losing his mojo, his aggressiveness, his ability to concentrate, his energy level, his libido, which is his sex drive, all can diminish over time, and it's very subtle to the point that a lot of times the patient doesn't realize it, but his coworkers and his family may notice it.
So this is something some people might think, is this just regular aging, kind of what happens to everybody, or is this kind of a real condition?
Well, this is a normal aging process. You heard the expression grumpy old men. Well, probably one of the reasons they're grumpy is their testosterone levels are low, their muscle aches, their libido is poor, their concentration is poor. And there's a lot of baby boomers like myself that we don't want to ride off into the sunset, quietly. We want to be out there rock climbing, skiing with our grandchildren, and this is a way to get there.
So there is a therapy for this, somewhat controversial. How does it work?
Well, it really works off measuring your testosterone level, which can, the gold standard is to do a blood test to measure your total testosterone. Normal levels are 400 to 1,000. Less than 400 would be abnormal. You can also do a salivary test, and if you are low, obviously see your doctor. And there's several forms of treatment, including gels. There's a patch that people can wear. There are injections, and then that you can give yourself once every 2 weeks.
Injections of testosterone.
Of testosterone. And then there's also pellets of testosterone, which a physician can insert, which are good for about 3 to 4 months in your buttocks.
So what are potential negative side effects, or are there?
Well, it is controversial. The American Academy of Endocrinology, they feel that really you should only replace testosterone if you're in the lower 10%. However, there was a study at UCSD looking at men over 60. They compared the men in the lower 1/3 of their testosterone levels to the upper 1/3. And the mortality rate was 33% higher in the patients with the lowest level for all diseases. There's I think that's a good indication that we may be better with higher testosterone levels.
And you're not only a believer of this for your patients, you're a believer of it for yourself. Tell us about what that process was like for you and how it's changed your own life.
As a young man, I was a hard-charging physician, and I realized that, and I didn't have as much energy. I'd go home at night, I'd be sitting in front of the TV where I used to be, studying and reading, and that was really related to the fact that I was in andropause. And I started myself on a testosterone cream 2 or 3 times a week. I was scientifically able to follow my levels and bring it up into a normal range, and I feel better, more energy, better workouts, better libido, all the good things I remember when I was a young man.
Glad to hear, and glad to hear the libido is good too. Happy about that. And you've got a book that you recommend about this. The book is called Testosterone for Life. You can get a lot more information about this on your website, and so we have linked to that on our website. And Doctor, thanks so much for being here. We appreciate it. And again, to get more information on that, you can go to our website, which is sandiego6.com. Just click on Hot Topics. Well, coming up, they're twins, and the story you'll hear when you might make them think about sharing a brain. The Honor Twin Society, sorry that didn't make too much sense. The Honor Twin Sisters in Florida shared at their high school graduation. Then, a Tennessee man has been very busy. We'll tell you how many children he's had in just over a decade.